What's going on, guys? It's Nate Humphrey, and today we'll be talking about the Alice in Wonderland syndrome. The Alice in Wonderland, or AWS, is a rare neurological disorder. It causes changes in visual perception, body image, and the experience of time. What is AWS? It's a rare condition that causes temporary episodes of distorted perception and disorientation. You may feel smaller or larger than you actually are. You may also find that the room you're in or the surrounding furniture seems to shift and feel further away or closer than it really is. These episodes aren't the result of a problem with your eyes or hallucinations. They're caused by changes in how your brain perceives the environment you're in and how your body looks. This syndrome can affect multiple senses, including vision, touching, and hearing. You may also lose a sense of time. Time may seem to pass faster or slower than you think. AWS primarily affects children and young adults. Most people grow out of the disordered perception as they age, but it's still possible to experience this in adulthood. It is also known as Todd's syndrome. That's because it was first identified in the 1950s by Dr. John Todd, a British psychiatrist. He noted that the symptoms and recorded anecdotes of this syndrome closely resembles episodes that the character Alice Lido experiences in Lewis Carroll's novel Alice in Wonderland. How does AWS present? Episodes are different for each person. What you experience may vary from one episode to the next as well. A topical episode lasts a few minutes. Some can last up to an hour and a half. During that time, you may experience one or more of these common symptoms: migraines, size distortion, perception distortion, time distortion, sound distortion, loss of limb control or loss of coordination. What causes AWS? It's not clear what causes this, but doctors are trying to better understand it. They do know that AWS isn't a problem with your eyes, a hallucination, or medical or neurological illness. Researchers believe unusual electrical activities in the brain cause abnormal blood flow in the parts of the brain that perceives your environment and experiences visual perceptions. This unusual electrical activity may be the reason of several causes. One study found that 33% of people who experience AWS had infections. Both head trauma and migraines were tied to 6% of AWS episodes, but more than half of AWS cases have known cause. Although more research is needed, migraines is considered the leading cause for AWS in adults. Infections is considered the primary cause for AWS in children. Other possible causes include stress, cough medicine, use of hallucinogenic drugs, epilepsy, stroke, brain tumors. Are there associated conditions or other health risk factors? Several conditions are linked to AWS. The following may increase your risk for migraines, infections, and genetics. How is AWS diagnosed? If you're experiencing symptoms like the ones described for AWS, make an appointment with your doctor. You and your doctor can review symptoms and any related concerns. There isn't any one test that can help diagnose AWS. Your doctor may be able to make a diagnosis by ruling out other possible causes or explanations for your symptoms. To do this, your doctor may perform MRI scans, electroencephalograph EEG, I'll put that on screen, blood tests. AWS may be underdiagnosed. This is because the episodes, which often last only a few seconds to a minute, may not rise to a level of concern for people experiencing them. especially true with young children. The fleeting nature of the episodes can also make it difficult for doctors to study AWS and better understand its effects. What treatments are available? There's no treatments for AWS. If you or your child experiences symptoms, the best way to handle this is to rest and wait for them to pass. It's also important to reassure yourself or your loved ones that the symptoms aren't harmful. Treating what you are and your doctors suspect is the underlying cause for AWS episodes may help prevent an episode. For example, if you experience migraines, treat them may prevent future episodes. Likewise, treating an infection could help stop the symptoms. If you and your doctor suspect stress plays a role, you might find that medication and relaxation can help reduce symptoms. Can AWS lead to complications? AWS often gets better over time. It rarely causes any complications or problems. Although this syndrome isn't productive or migraines, you'll most likely to develop them if you have these episodes. According to one study, a third of people without a history of migraine headaches develop them after experiencing AWS. What's the outlook? While the symptoms can be disorienting, they aren't harmful. They're also not a sign of a more serious problem. AWS episodes can happen several times a day for several days in a row, and then you may not experience symptoms for several weeks to months. You will likely experience fewer symptoms over time. The syndrome may disappear entirely as you reach early adulthood. Alright guys, I hope you guys enjoyed that. I hope that helped a little bit with like what that actually is. I was kind of curious too, to be honest with you. So if you've either had that or you know someone that is suffering with this, just be with them. Go to your doctor if you need to. I'm not a doctor by any means. I just like to spread awareness of different like syndromes and disorders, and if you have any like recommendations you want me to do next, let me know down below. I appreciate every single one of you guys. You guys have been crushing this channel. I appreciate you guys, and I hope these videos help you in some way. Make sure you share them with friends to get the message out, and stay tuned for more by hitting the bell and notification. I love you guys. Stay safe. I will see you in the next video.